All right, here we go. Hello everyone, and thank you for watching this program on the best personal injury codes. There's no audio taping or videotaping allowed, and any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. The information contained in this presentation is for educational purposes. It's not intended to be a substitute for your thorough clinical decision making, and it should not be construed as any written policy for any federal agency. It's not intended to be legal advice. We don't engage in providing legal services. If I discuss CPT codes, just a reminder, CPT is a registered trademark of the AMA. I've made every attempt to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. Just a little bit about myself before we get going here. My name is Dr. Marty Kotler. I am a chiropractor. I'm certified in CPT coding. I'm a certified professional compliance officer. I'm also the president of Target Coding. My areas of expertise include HIPAA compliance, coding, documentation, Medicare, creating compliant cash plans, and CPT ICD-10 code pairing. I've written many books on billing and coding and documentation for chiropractors. I write articles for Chiropractic Economics and Dynamic Chiropractic. I'm a featured speaker for the Coding Institute, Parker Seminars, and for Foot Levelers, plus I'm a guest speaker at many state association conventions nationwide. I'm going to be speaking for many associations throughout the country. Those of you listening to this presentation, if you're a member of your state association that's looking for a guest speaker on coding, compliance, documentation, let us know. We typically can get a sponsor and attend your state convention. Our calendar is pretty booked for the rest of this year, so you might want to contact us about your conventions starting in the next year. Alrighty, so here we go. A few key points here regarding personal injury. Many patients choose chiropractic care for treatment of injuries relating to automobile accidents, on-the-job injuries, and many other types of trauma. You know, when typical doctors of chiropractic and staff members hear, you know, the terms personal injury, you automatically think automobile accidents, but personal injury could be somebody's walking down the street and something falls on their head off of a building, you know, so that's, you know, also a personal injury type of situation. You could have a patient that's walking in the lobby of a hotel, and the water, there's water on the floor of the lobby, and the person slips and falls. So there's other types of personal injury type situations that are not related to auto accidents. But the conditions that present to chiropractic offices nationwide are typically for traumatic type of soft tissue injuries, contusions, pain, ligament problems, stiffness and swelling. However, there could be more complex type of injuries that occur, like visual disturbances, headaches, numbness, sleep disorders, dizziness. Those of you that treat PI patients, you know patients can come in that they've never had the condition that they're presenting with prior to the accident. It was after the accident. So that's important as far as documentation goes. So let's start off with a few of these traumatic type of injuries and diagnosis codes. We're going to be focusing on the most common types of ICD-10 codes that relate to personal injury. Let's start off with traumatic headache codes. So here's a couple right here you see on your screen. There's G44.311, that's acute post-traumatic headache, intractable. And then we have G44.319, acute post-traumatic headache, not intractable. So when you're looking at headache codes, you're going to see some choices. For example, with many headache codes, you're going to see a choice with aura and without aura. So what's aura? You should be familiar with that. Most of you probably know what that is. Aura is that perceptual disturbance that occurs prior to the headache even starting. So during your consultation, I would recommend that you ask patients, hey, Mrs. Jones, I see that you have headaches. Prior to the headache coming on, do you get the feeling of confusing thoughts, or maybe you see strange lights, or you smell strange smells? And the patient goes, yes. How did you know that, Dr. Kotler? Yes, I could feel something ain't right before the headache even starts. So you would choose the headache code that says with aura. So some of these things you can find out just by talking to patients. There are actually many diagnosis codes that you can come up with, and many examination findings that you can come up with without even touching the patient. You could find out certain things to narrow down your diagnosis codes just by speaking with the patient. Another one here you'll see on the screen here with the post-traumatic headache. See, there's also the chronic post-traumatic headache, the G44.321, intractable, and G44.329, chronic post-traumatic headache, non-intractable. So what's that? Intractable, not intractable? You know, again, that's something that you can ascertain just by talking to the patient. So, Mr. Williams, you tell me you get headaches. What do you do for your headaches? Have you done anything? And Mr. Williams says, I've tried everything, Dr. Kotler. I've tried over-the-counter medication. I've tried acupuncture. I've tried physical therapy. Nothing helps. Everything I try just doesn't seem to work. That's considered intractable. So again, just by talking to the patient, you can start narrowing down your diagnosis codes. If you go, Mr. Evans, tell me about your headaches. Do you do anything for it? And he says, yes, well, you know, I get massage and I put heat on it, and that helps. It does give me some relief, but it's not long lasting. So he is getting some help from quote-unquote conventional methods. That's not intractable. So there's a few traumatic headache codes, and of course patients come into chiropractic offices all the time stating, Dr. Kotler, I was in a car accident. After the car accident, I felt some neck pain. I've never had headaches before, and then a few days later after the car accident, or a couple of weeks after the car accident, I started to develop headaches. So the headaches could have been something called a sequela to the original injury. We're going to get into those encounters in a few minutes. So that's pretty common for patients that have been in accidents to develop headaches post-trauma. And then there are some regular migraine headaches, and you'll see here there are these choices, G43.001, migraine without aura, not intractable, with status migrainosus. Yeah, that's another choice you may see with some headache codes. What is status migrainosus? Status migrainosus means the patient's headache has gotten so bad that they've had to be hospitalized. They may have to be put on IV medication. You know, these patients are becoming dehydrated, nausea, vomiting. So it's another question you could ask patient, and that's another choice you'll have in headache codes. G43.009, migraine without aura, not intractable, without status migrainosus. Then there's G43.011, migraine without aura, intractable, with status migrainosus. G43.019, migraine without aura, intractable, without status migrainosus. So there's a lot of combinations here. Make sure you're choosing the most appropriate diagnosis code. You always have to choose codes to the highest degree of specificity. You know, just like if you went to a doctor for whatever reason, for whatever doctor you attended, you would want to be provided with the most appropriate and correct diagnosis, right? You wouldn't want to be misdiagnosed. Same thing with your patients. Now let's talk a little bit about S codes. S codes, what does that mean? So, S codes are trauma or injury-related codes. S codes are in Chapter 19 of the ICD-10 tabular list, the ICD-10 master list. S codes, they relate to trauma, injury. For example, sprains, strains, fractures, traumatic brain injury, concussions, contusions, traumatic subluxations. So these codes that begin with the letter S require to have a 7th digit extender which depicts the encounter. So S codes must have a letter at the end of the code. S codes are always 7 digits. You know, there are some codes like dizziness is 3 digits, R42. S codes must be 7 digits. They must have a letter at the end. That letter indicates the type of encounter. There are 3 types of encounters. A is initial encounter, D is subsequent encounter, and S stands for sequela. So let me go through a couple of examples here with you with S codes. So the letter A means initial encounter. So you're going to use this encounter when the patient is receiving after treatment for the condition and you're the first provider the patient visits for the present condition. So, for example, Mr. Williams is in a car accident. After the car accident, he feels neck pain, back pain, and he comes to you. You're the first provider that Mr. Williams sees. You check him out, and you find that he has sprained ligaments. In this example on the screen, sprained lumbar ligaments. Because he came to you first, you're going to use the letter A. Mr. Williams gets 10, 15 treatments. Leave the letter A on every visit. That's how it goes with the initial encounter. Now let's talk about subsequent encounter. You're going to use this encounter for follow-up visits after the patient has seen another provider. Same situation. Mr. Williams is in a car accident, has some injuries. After the car accident, Mr. Williams goes to the emergency room, or he goes to his medical doctor, and the medical doctor says, Mr. Williams, no fractures, no broken bones. I recommend you, put some ice on it and rest for a few days. And if you're not better after a few days, you should go see somebody. A few days later, Mr. Williams is not doing better, and now he comes to see you. So you're going to use the letter D for subsequent encounter. Mr. Williams gets 10, 15 treatments or so. Use the letter D on all visits. So this is my recommendation. This works 99% of the time. You may come across a few health plans. I've had some of the doctors I work with come back and say, Marty, well, I've been following your recommendation, but this particular health insurance company wants me to use the D here and the A here and the S here. So whatever they say, go ahead and follow that. But 99% of the time, just follow my recommendations. A for initial. The patient comes to see you first. If they go somewhere else and then come see you, use the letter D. And think about it. The most important part of the diagnosis is the beginning of the diagnosis. In this example, the S33.5, make sure you get that right, because that's what you're hanging your clinical decision on. The A, the D, or the next letter, the letter S for sequela, that's for insurance. In my opinion, that's used for insurance company tracking purposes. It shouldn't have an impact on how you get reimbursed. So the last one here is S for sequela. This is the late effect, a problem of an original problem. The examples that I read in my ICD-10 guidelines and alerts that I receive in bulletins and newsletters, they always talk about patient is burned in a fire, and then 6 months later they develop scar tissue. So the scar tissue formation is a sequela to the original problem. So if that's happening, you have situations in your practice where an S code would be a sequela to an original problem, go ahead and use it. I don't really see it that common in chiropractic. Yes, there are situations where a late effect can occur. As I mentioned earlier, patients in a car accident, and they develop neck pain, and you have maybe cervical sprain and strain, and then they develop headaches a few weeks later. So yes, the headaches could be a sequela to the original problem, a late effect. However, headache codes begin with the letter G. G codes don't require these 7th digit extenders. So now I'm going to share with you some of the most common S codes. Let's start off here with TBI, traumatic brain injury, and there are different levels here. So diffuse traumatic brain injury without loss of consciousness, that is the most common, at least in my experience, um, treating patients with TBI and working with doctors all over the country. Patients don't typically lose consciousness, so then you would use S06.2X0, and you see there's a little underscore there. That's where you need to fill in the blank with either an A, a D, or an S. Now the patient, after the car accident, they might have diffuse traumatic brain injury with loss of consciousness just for a few minutes. Important question to ask the patient. Maybe it's in the police report. So if it's 30 minutes or less, that's S06.2X1. If the diffuse traumatic brain injury with loss of consciousness lasts 31 to 59 minutes, that's S06.2X2, and there are many others. Just wanted to give you a few of the more common ones. So that's TBI. Now we're going to talk a little bit about concussions. Also seen with trauma and injury, and it doesn't have to, again, it doesn't have to be automobile accidents. You could be treating, a weekend warrior that loves to play sports or flag football or lacrosse on the weekends and gets hit in the head pretty hard and now comes to see you, and you diagnose this patient with a concussion. Maybe you have a concussion protocol that you put the patient through. There are many great courses out there given in the chiropractic profession on personal injury. Of course, Arthur Croft is the first person I think of when I think about personal injury, but there are many excellent courses out there that teach you how to come up with these clinical decisions. I recommend, if you're going to treat trauma type of injuries, take some of those courses on the clinical aspect and then use our resources for the coding aspect. So a concussion without loss of consciousness is S06.0X0. Now those are all zeros, by the way, in these codes, not the letter O. These are all the number 0. Concussion with loss of consciousness for 30 minutes or less. Again, these are based on time. TBI and concussion are based on the amount of time the patient loses consciousness. 30 minutes or less is S06.0X1. Concussion with loss of consciousness for an unspecified amount is S06.0X9. Now here are some of the more common ones you'll see. Cervical sprain, S13.4. Sprain relates to ligaments, traumatized ligaments, overstretching of ligaments. And we have cervical strain relates to the muscles. Strain relates to muscles. Also overstretching or maybe tearing of muscles is strain, S16.1. Now, if you remember back in the day with ICD-9, sprain and or strain were lumped into one code. In ICD-10, it got separated out. In my opinion, a typical whiplash type of situation, hyperflexion, hyperextension injury, you're getting sprains and strains. Similar in the lower back, here's lumbar sprain. Again, sprain relates to ligaments. Strains relate to muscles. Sprains take longer to heal. I mean, just think about, I don't know, a famous sports person, Venus Williams. You find out Venus Williams, excellent tennis player, you find out she sprained some knee ligaments. She could be out months and months, but you find out that she strained a hamstring muscle. A couple of days, maybe a week or so, she'll be back on the court. So muscles heal faster than ligament injuries. And then there are certain ways in which you can grade. I think it's a good idea to grade sprains. A grade 1 sprain, minor damage, most ligaments are intact. Grade 2 is moderate, partial tearing, abnormal laxity. Grade 3, severe, complete tear of ligament, significant instability. If the patient had a grade 3 sprained ankle, probably couldn't even walk. And then we have grades of strain. So grade 1 strain, mild, minor damage to muscle fibers, some swelling. Grade 2, moderate, more extensive muscle damage, maybe some hemorrhage. Muscle is not completely ruptured. Grade 3, severe, complete rupture of the muscle. May even require surgery. So the more specific you are with your ICD-10 codes, the better off you're going to be. So with ICD-10, it's created this roadmap that some doctors are not used to driving down, where you have to increase the specification, the specificity of the code you're choosing in order to justify it. So justifying your ICD-10 codes is more important nowadays than ever before. Here's another common sprain code, sacroiliac sprain. I'm sure many of you have diagnosed patients with sacroiliac joint issues like sprain, sacroiliitis, sacroiliac subluxations or fixations. That's S33.6. So let's say you diagnose a patient with sacroiliac sprain, and now you're being questioned either by an insurance company reviewer. It could be a state board issue. Even cash patients can file complaints against you, and I've dealt with that a few times with doctors across the country, working with a few right now, where cash patients filed complaints against the doctor. Now the doctor has to send his or her notes to the state board with the financial information, and now the doctors are getting their documentation scrutinized from a cash patient. So it could be a state board checking you out. A malpractice case is where your diagnosis codes can come into question, and of course in insurance reimbursement situations. So if you're ever asked, hey, Dr. Kotler, you diagnosed this patient with a sacroiliac sprain, how did you come up with that? Make sure you have good quality answer. A good quality answer would be, well, there you go, it's on your screen. The patient came in with pain in one or more of the SI joints. My orthopedic tests include Yeoman's, Ganslin's. There you go, those two tests. There's a few others there. Knockless for Bearpatrick. It's a good idea to do a couple of these gold standard tests that relate specifically to the SI joint. It'll help your case. Now, I speak to some chiropractors. They go, Marty, I don't do any ortho tests. I don't do any neuro tests. I don't even own a stethoscope. I don't check blood pressure. I don't check reflexes. Okay, there are a lot of, chiropractors that are, just more subluxation based, I guess you can call it. But if you don't do a couple of these tests, and it's a malpractice case or a state board issue, it's going to be hard to defend. You're probably going to lose. So do a couple of these tests. Chiropractic evaluation revealed some tenderness, some hypomobility, subluxation. Another common scenario is with cervical radiculopathy. I'm sure many of you have diagnosed patients with cervical radiculopathy. So if you're questioned, if somebody's snooping around, so to speak, and says, hey, Dr. Kotler, you diagnosed this patient with cervical radiculopathy. How did you come up with it? Make sure you have some good answers, like, okay, so the patient had pain in the neck radiating into the upper extremity, and here you go. Jackson was done, Valsalva, Sperling. Take a look at these ortho tests, neuro tests. We checked reflexes. We looked for any type of myotomal weakness, dermatome changes. If you're not sure, maybe you've been out of chiropractic college for a while, you're not sure what Sperling is or shoulder depression. It's so simple nowadays. I go to YouTube, I type in Sperling, up pops all these great little quick videos that show you how to do it as a little reminder. So YouTube could be your best friend when it comes to just getting a refresher on some of these ortho and neuro tests. The chiropractic tests revealed limited motion. So you always want to be able to justify every diagnosis code that you come up with. So oh yes, this is there's a book that I recommend that has a whole bunch of the diagnosis codes plus the ortho, neuro, chiro tests to help substantiate the ICD-10 code that you choose. So here's how to substantiate sprains and strains. And if you're going to diagnose a patient with cervical brachial syndrome, that's another common diagnosis code, M53.1. Do Wright's, Atson's, some upper limb tests. So I'll let you know the book that has this information in it a little bit later, but this is an excellent book. This is an excerpt of one of the pages. And then we have traumatic subluxation codes. Okay, wait a second. What are these? Many of you are using the regular subluxation codes, the M99 codes. That's fine. And here we have the lumbar subluxation codes. Again, these are trauma-related, injury-related, so those codes begin with the letter S, and they get bone-specific. Cervical subluxation, there's 7 choices here. Thoracic subluxation, there are 12 choices. Now, these are the trauma codes, the trauma subluxation codes. Here are what I call the regular subluxation codes. In my experience, I haven't seen a real big difference in reimbursement, whether you use the M99 codes versus the S subluxation codes. To me, these are easier to report. For example, thoracic segmental dysfunction, M9902, that's the code you would use whether it's T2, T8, T9, T12. If you're going to use the traumatic subluxation codes, you're going to have to, and there are 4 in the thoracic area, then you would have to report 4 separate codes. So these are the regular. Segmental dysfunction, also that term could be interchanged with subluxation codes. Now we have cervical disc disorders and cervical disc displacement. Here's a couple of examples. What's the difference between a disc disorder and a disc displacement? That's a common question that I get asked all the time. And many doctors, hey, I didn't know the difference until about 3 years ago when I started reading the ICD-10 guidelines. I don't remember being taught the difference in chiropractic college. So a disc disorder means that there's some sort of nerve root compression. There's radiating pain or radiculopathy. Disc displacement also means there's some sort of disc pathology like a bulge or herniation, but there is no nerve root compression. So there's no radiculopathy and there's no myelopathy. What's myelopathy? That's another common question I get asked. Dr. Kotler, I'm not sure what that is. So that means that there's some sort of cord compression. So again, make sure you're choosing the correct diagnosis code. You don't want to pick a disorder, a disc disorder, if the patient doesn't have any nerve root compression. Oh, so here's the difference. Disc disorder, herniation, bulge, protrusion, something's going on with the disc, but the patient does have radiating pain. And disc displacement, there isn't any nerve root compression. Oh yeah, here's the question that I oftentimes get. Well, Dr. Kotler, I get these questions all the time. What's the difference between myofasciitis, myositis, and myofascial pain? What's the difference between sprain and strain? What's the difference between disc disorder and disc displacement? What's the difference between muscle spasm and contracture? All these different questions. What's the difference between radiculitis, radiculopathy, and myelopathy? So in that book that I was referring to earlier, there's a section on all these FAQs, common questions. So radiculitis is inflammation. Radiculopathy is nerve root compression. Myelopathy means there's spinal cord compression. Spinal cord compression, you would need an MRI or a CT scan. And here are just the regular pain codes. Neck pain, M54.2, thoracic, 0.6, lumbar, 0.5. Sometimes doctors say, well, wait a second, Dr. Kotler. Neck pain, M54.2, that's a diagnosis? To me, that's a symptom. Well, it's both. If the patient, if that's all you got, neck pain, then you would need to report it if there's no other underlying cause or reason for the pain. You don't have anything else. Yeah, but, just neck pain, let's say, Mrs. Jones comes into the practice and she says, Dr. Kotler, I have neck pain. I was injured in an accident. And then you do a thorough history, a comprehensive exam, you take x-rays, and then during the report of findings you go, okay, Mrs. Jones, I know what the problem is. You have neck pain. That's your diagnosis. She'll probably say, wait a second, I told you that. So What's causing the pain? Anything else going on? Subluxation, spasm, nerve root irritation. And then we have muscle spasms, 4 choices there. Ligament laxity, disorder of the ligament, M24.28. Many of the doctors I work with like to use this diagnosis. I think it's an excellent diagnosis. It's not easy to, in my opinion, it's not easy to come up with this diagnosis. It shouldn't be taken lightly. You know, if you're going to diagnose a patient with some sort of ligament instability, you have to have something to back it up. It can't just be like, yeah, I think the patient has it just by talking to the patient. No, there are certain things you'd have to do. There are certain measurements, whether it be X-ray or MRI. I'm not an expert on coming up with that definitive diagnosis, but it is used a lot. It is very common. Many patients have ligament issues, and they have these types of complaints and symptoms that just linger, and nobody seems to be able to get to the bottom line, and it could be due to some sort of ligament instability. Chiropractors are experts at finding this, so M24.28. Next, cervical kyphosis. That could occur. There are situations where after an accident, an injury, on X-ray, you see a reversed cervical curve, M40.292. Sleep disorders, yes, that is very common. Patient says, I've never had problems sleeping ever since the car accident. I can't sleep through the night. After a couple hours, I'm tossing and turning, G47.9. Anxiety, depression, F41.8. You know, just think about it. You have 2 patients coming into your practice. Patient A has back pain. That's it. Patient B has back pain plus is taking medication for anxiety, depression, is overweight, has maybe diabetes. So we have these complicating factors and contributing factors. Patient B is going to probably take longer to get better than patient A that just came in with back pain and nothing else. Tinnitus, ringing in the ear. I have 3 codes there. H93.11 is the right side. H93.12 is left side. H93.13 is bilateral tinnitus. Dizziness, absolutely, pretty common after trauma. That's R42. That's it, 3 digits. And here's just a few more that I wanted to throw in here. Jaw pain, R68.84. Contusion of the head, S00.93X. Contusion of the neck, S1083X. Nausea, R11.0. Pins and needles, R20.2. Abnormal posture, R29.3, generalized muscle weakness, M62.81, contusion of the front wall of the thorax. How would that happen? Seatbelt, right? Seatbelt, contusions. It's probably a good idea. Check with your state board. Make sure you're okay with this. A patient comes in with a contusion or a bruise, take a picture of it. Those little things can help the case. It could help prove that there's some serious injuries there. It could help increase the value. When you're documenting the patient's symptoms, there's something called loss of enjoyment of life. Patients just say, you know what, I usually go bowling every week. I'm in a league, and ever since the accident, I just don't feel like going anymore. So loss of enjoyment of life is a category that's discussed. You want to make sure patients are compliant with their care. It's a good idea in your SOAP notes to ask patients, are they compliant with the ice packs you've told them to use, or the lumbar braces, or the TENS machines. Shoulder swelling, M25.411, right side, 2 is left side. That's laterality, 1 is right, 2 is left. Knee contusion, S80.01 on the right, 2 on the left. Just lack of energy, lethargy. Yes, patients say that all the time. Ever since the accident or injury, Dr. Kotler, I just don't feel like doing anything. Loss of enjoyment of life. don't want to go to church, doesn't want to go to any social activities. Important things to document, and if the patient has an attorney, the attorney would probably want to know these things. So I'd love to talk more, but we've run out of time. So just a few closing comments. Please check with the carriers you bill prior to submitting claims to ensure that it's compliant. We can't guarantee this information. We'll guarantee payment from any health plan or patient. We're not responsible for any changes that may occur following this presentation. And insurance carrier rules change all the time. So do your best. Stay on top of changes. Attend seminars. Attend webinars. Join your national and state professional associations. There's our contact information. We're going to get to questions in a couple of minutes here. Just if you have questions for us, you want to email them, info@targetcoding.com. Our website is targetcoding.com. Telephone number, 1-800-270-7044. Our HIPAA secure fax number is 1-844-831-2347. And earlier I had mentioned a book that gives you those diagnosis codes and the clinical scenarios and how to justify the diagnosis with ortho, neuro, chiro tests. There's a whole bunch of them in this book. This book is on the best chiropractic ICD-10 and CPT codes to improve reimbursement. Yeah, I like the tagline. It says, learning how to bill and code isn't expensive, but neglecting it and defending it is. And here are a couple of excerpts. Yes, we also have in this book, there's some cheat sheets. We have them specifically for personal injury. We've laid them out into head, neck, ribs, sacroiliac joints, miscellaneous categories, and then we get into all the most common trauma to the extremities. Yes, here's the excerpt of the book on the diagnosis codes and how to justify them with your ortho, neuro, and chiro tests. Oh, this is something that I like to share. Code pairing. Pairing your CPT codes to your ICD-10 codes is very important, again, to justify treatment. You always have to be able to justify your diagnosis codes and your procedure codes. So I look at this just like you go to, pair food with wine. Like red wine goes with meat, and white wine typically goes with fish and seafood. So, I love going to wine and food festivals. I like to learn about the combination. So with coding, similar thing. If you're going to do manual therapy, that's myofascial release type of work, 97140, that pairs beautifully with right shoulder stiffness and myofascial pain syndrome. So in the book that I'm referring to, there's a whole bunch of ways to pair. For example, here, this is 97110, therapeutic exercises. It gives you the clinical rationale and the documentation suggestions, so you have the right verbiage in your notes to prove that you're using it properly, and then it gives you a list of all the diagnosis codes it pairs with. So therapeutic exercises pairs beautifully with neck pain, cervical sprain, nerve root injuries, strains, disc disorders, disc displacements. Yeah, and the book also has these FAQs. What's the difference between effusion, swelling, and edema? What's the difference between idiopathic scoliosis and thoracogenic scoliosis? So I would recommend the book. We also offer at Target Coding compliance manuals. The first one is OIG, that stands for Office of Inspector General Compliance. If you treat Medicare patients, this is mandatory. It's not optional. It's not a suggestion. It's mandatory that you have a compliance manual. If you treat Medicare patients, we offer them here at Target Coding. It's not complicated. It's pretty simple. Our compliance manual is about 40 pages. It just lists all your policies and procedures. You're required under the Medicare law to do internal chart audits. We have this little tool that we give you. You go down a checklist to make sure you're doing it right. We also offer HIPAA compliance programs. HIPAA is also a law. I'm not saying this to scare you. I'm just saying this to educate you. It's mandatory. It's not voluntary. All 50 states, HIPAA is mandatory, and it's becoming more and more enforced because of all the cyber criminal activity. You could have a CA inadvertently click on an email and it causes a breach. If you don't have HIPAA policies and procedures in place and a patient files a complaint against you, $50,000 fine. Ouch, that's painful. So to me, this is just like homeowners insurance, life insurance. A HIPAA compliance program is like insurance for your practice. So we offer that. We do seminars, webinars. We offer a lot here at Target Coding. We offer memberships. This is our basic membership, $99 a month, pay as you go. It includes all of our paid webinars. This was a free one, but we have a paid webinar coming up later today. If you're a member of Target Coding, no charge. We do them just about every week. Plus, you can get all your questions answered. We also have a gold membership, platinum membership. We offer a free coding and compliance evaluation. Hey, you're just not sure about how things are going. You just want to pick my brain for 15 minutes on what's going on in your practice? Let us know. So again, here's our contact information, info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044, fax 844-831-2347. I want to thank everybody for attending. I hope you learned a lot.